Look, I think I might just start. It's 2 minutes past 2, and these sessions always go really, really quickly. So I can do my intro bits while we're seeing people kind of flood in. So that would be great. So welcome everybody to our event this afternoon. I'm Sarah and I'm the Chief Exec at the Centre for Mental Health, and it's my great honour to host this event this afternoon. And I think I just want to have a couple of opening remarks really before we hand over to our extraordinary speakers. Look, we at the Centre highly value the work that we've done over the years, and one of the things that we are the most proud of is our report, the seminal piece, Breaking the Circles of Fear, that was published way back in 2002. And many of you on this call may remember when it was first published. We're really, really lucky to have the author of that report, Professor Frank Keating, with us this afternoon to talk about it. But we really wanted to come together 20 years on to really honour that work. To call it a celebration almost felt a little bit odd, but what we wanted to do was to make sure that we recognised the impact of the work, how incredibly groundbreaking it might have felt at the time. We recognised that it did absolutely support new conversations. We were able to talk about racial equality in a way and racial justice in a way in policy circles that we'd never been able to do before. The work had been built on the shoulders of giants, people's lived experience, those people who'd been doing this work for a number of years. And of course, since then, many of those people that were working with us then are still doing that work now and have joined us this afternoon. I think it's fair to say that when we talk about progress in racial justice and mental health, that we may have not got to the place that we should have done. I think many of the recommendations in the reports that we made 20 years ago, we could probably make now, except we have a number of individuals that are leading the way, that are doing work that, you know, if we had thought about it 10 years ago, couldn't have imagined doing that, which is why we have Dr. Jacqui Dyer with us here this afternoon, because she has led Advancing Race Equality across mental health in the NHS. And again, if we had imagined what that might look like, even, you know, 5-10 years ago, that would have been very difficult. And so we now have powerful leaders within our system. But it is clear that the work must continue, and I guess we at the Centre do want to continue that work. We know that we don't need to be at the centre of it, mostly because we know that people like Jacqui, like Frank and others are still doing that work and making great strides. But we at the Centre want to be an ally, we want to support, we want to create opportunity for the experiences of those people from racialised communities to come to the very fore and to be the centre, at the heart of everything that we do going forward. So we're here today and we're going to hear from, as I say, the original author of the report, Professor Frank Keating, who is at Royal Holloway. It's a great honour to have Frank with us today. And I think when we hear him speak, it will be almost like being in that moment again 20 years ago when all of this work felt like it was just starting to break ground. Then we are going to hear from Dr. Jacqui Dyer, who is going to talk about her role in, you know, changing the face of Black mental health in the UK. She is the founder of Global Black Thrive, and she will be talking about her own reflections about the 20 years since we published this report. And then we're going to hear from Chika, who is a co-producer at the Changemakers programme that we're running alongside the Diana Award, and she's going to talk about her own experience now in relation to mental health campaigning and so on and so forth. And then we're going to have a panel discussion with Kadra, who is on our team, is the Director of Children and Young People's Mental Health. So enough from me. I think we really want to start hearing from our speakers. So the first thing that I want to do is to ask Professor Frank Keating. I think He's with us. I saw him earlier on. Are you here?
Yes, I am.
Lovely, lovely. Professor Frank Keating, I mean, we would like to sort of listen to your views really about the last 20 years, your experience on the report's impact, the relevance of the recommendations 20 years on, and just kind of, you know, your position now after all these years. And I'll hand over to you. And I'm meant to be the clock watcher, but you know, I will be guided by you when you've had enough time.
Okay. Well, thank you very much for the invitation, and good afternoon, everyone. And it's also nice to see some familiar faces on the call. I'm pleased to see Matt Nugent here, who was a director at the time, and would also want to thank him for supporting this work from the start, and that was really good. And I think there's also some of the service users or people with lived experience who were involved in the project, I think are on the call, and I want to acknowledge them because I think this was really groundbreaking work because it was the first piece of work around race and mental health. And what I did is I trained people with lived experience and people with caring for people with lived experience as peer researchers to conduct my focus group. So that in itself was a groundbreaking piece of work. And I can't believe I'm here 20 years on to talk about this. And I can say Breaking Circles of Fear on my ResearchGate profile is still my most read publication. And so people are still interested in this piece of work. So it's really, I feel quite humbled by that. And I vividly remember, and I'm sure Matt will remember, 20 years ago, the report was launched in the House of Lords, and it was the hottest ticket available in town. Everybody wanted to be there. Everybody wanted to participate in this event. So it was really, yeah, so I think that was an important day. And I've been asked to sort of talk a little bit about the impact of the report. And I think the first impact for me, and perhaps the biggest, was for me when we sent the report out to all the people with lived experience who participated in the study or in the review. And I had a call back from somebody and said, "Thank you very much. This is my voice, and I can now take it to my psychiatrist and say, this is my experience that you have never understood. Read about my experiences in this report." And that for me was probably one of the most significant things about the report. And I felt if nothing ever happens after this report, that this report captured the lived experiences of people from racialized minorities, and that for me was really important, but was really impactful. But I think the report had some other impacts. As Sarah said, it got enshrined in what I will talk about in a little moment. It got enshrined in the Delivering Race Equality framework. One of the key action points, the first action point of the Delivering Race Equality framework, was to reduce or to break the circles of fear. So it got written into a policy document. There was also, as part of the Delivery Race Equality Program, there was a national engagement project where they set up 80 community engagement projects across the country, and that was one of our key recommendations in the report, that there should be engagement with our communities. There is finally, and I'm hoping Jacqui will talk about this, is finally mental health advocacy enshrined in our mental health legislation, which we advocated for in the report. Improving access to psychological therapies was set up as a result of Breaking Circles of Fear. Unfortunately, the IAP services don't recruit people from racialized minorities as well as they should, but the IAP was set up on the basis of this report. So there's quite a lot of things. The NHS also set up the BME leadership program, which is still running. So quite a number of things have happened, and now people will say, but so why are things not changing? And I think things are not changing because there have been a number of missed opportunities. The first missed opportunity, I would think, was the report into the death of Rocky Bennett by the hands of nursing staff. This report clearly said that there was institutional racism within psychiatric services, within mental health services, and there was an opportunity missed to really develop and root out institutional racism in psychiatric services. And so that was the first missed opportunity. Second missed opportunity was a report written by Shashi Duran, who's a psychiatrist, I'm still working with him on a local mental health project in Wandsworth. And Sashi's report was called Inside Outside. And this report clearly argued for institutional change within within what we sort of roughly call the system, but he also called for change within our communities, and our communities talk about mental health, how particularly our racialized communities. And yeah, this nice idea that there should be work inside, but there should also be work outside, and you need to bring this together. So the government's response to these two important documents was then not directly, but indirectly, to produce the Delivery Race Equality Framework. And we know that the Delivery Race Equality Framework was premised on three building blocks. The first building block was better information, more relevant and appropriate services, and better community engagement. We know that the program ran for 5 years, and at the end of 5 years, there was universal agreement that actually the program didn't deliver what it aimed to deliver. And there were various reasons for that, and we don't have time to go into that here. But I think that was another missed opportunity. And I think our final missed opportunity is the review of the Mental Health Act. When I was asked to comment on the review of the Mental Health Act, and I said, we don't need a review of the Mental Health Act. What we need is a national strategy to address institutionalized racism in our psychiatric services. We need a strategy that can work towards mental health promotion within our communities. But we also need a strategy that can speak to the diversity of the human experience, because we cannot, I think our problem perhaps has been that we try to understand issues of race and racism in isolation of the other diversities we have. And so I am working at the moment, and at that time I didn't have the language, and now we do have the language, and we talk about intersectionality. And so I think that's really important. And so where do we go from here? And I would sort of just in the last few minutes that I have, want to say that I follow the lead of Pierre Bourdieu, who's a French philosopher, and he introduced us to this term called social suffering. And social suffering is the pain that is caused by our social institutions. And it's that pain that racialized minorities experience when they come into contact with an educational system that doesn't support them, when they come into contact with an economic system that doesn't support them, when they come into contact with the criminal justice system that doesn't support them, and then they come into contact with the mental health system that doesn't support them either. And that is what Bourdieu says is what we need to address, is we need to address social suffering if we want to eradicate the racialized suffering that people experience. So that's my first point. My second point is drawing on the ideas from two people I like quite much is Frantz Fanon, who was a Black psychiatrist who wrote the seminal book, Black Skin, White Mask. And he talks about we need to understand the impact of racialized trauma on what he calls the Black psyche. And I think I've just done a piece of work where I was talking to African and Caribbean men, trying to find out what mental health recovery means for them. And before the men talked about mental health recovery, they said, look, I need to talk about other stuff that's happened in my life. And they talked eloquently about racialized trauma, racialized bullying, and how these things have had a significant impact on their mental health and their mental well-being. And so I would argue that if we want to address some of these issues, we also need to begin to understand the impact of racialized trauma on people's mental health and their well-being. And then I also want to draw on Claudine Geronimus's idea of racial weathering. And she talks about how living in a racialized society, it eats away at your health. But I would add to that, it eats away at your mental health, and it's cumulative. And so therefore, when we work with people, when we try and want to support people from racialized minorities in dealing with mental distress, we need to understand these processes. We need to understand social suffering. We need to understand the impact on people's psyche, and we need to understand this whole cumulative effect of it. And I think if we can do something like that, then maybe we would be closer to providing relevant and appropriate services. And I think I'm going to just look at my notes, and I think, so for me, finally, to bring race back on the agenda, because I think when we had Delivering Race Equality, people said, oh, we've done race, we're fine now. And I think, no, we haven't done it. And so what I would say is, I still am advocating, my mantra at the moment is we need a national strategy for race equality that embraces human diversity. Thank you, Sarah. I'm going to stop here.
Thank you so much, Frank, and it's mesmerising listening to you. And I often, when I've heard you speak before, I think what I've always taken from it is this kind of depth of the listening piece, which is, can we truly listen, hear and bear the truth of the racialized experience that has been so starkly drawn through your work and through some of our work in recent years with young men in London and in Birmingham. We are going to invite questions, and so do use the chat for questions, because we'll have a panel discussion later on. But before we do that, I'd like to invite Dr. Jacqui Dyer. I did see her earlier on, so I also know she's here, to share her reflections with us from her own leadership in challenging systemic racism and the oppressive practices that it enables. Jacqui has led the groundbreaking initiatives in NHS, which include the patient and carer race equality framework and advancing mental health equalities. Jacqui, over to you. And again, I'm meant to be timekeeper, but when you've finished speaking, you let me know.
Thanks, Sarah, and thanks for the invitation here today. I'm going to speak with brevity, I hope, as my own mental health is not at its best state at the moment, and I'm also suffering from long COVID, so I just want to manage expectations. So Frank sort of give a real summary of the impact of the Breaking the Circle of Fear report and its sort of ongoing relevance, actually. I think people may be aware that some data just came out recently about, I think it was from the Race Disparity Unit, that there are rising levels of detention under the Mental Health Act, particularly for Black people, where the rate is currently five times that of our white counterparts. So the issues around overrepresentation and the differential experience is actually still ongoing. I don't know if you can hear me, somebody's trying to get in on my phone at the same time.
We can hear you.
Excellent. Okay, and I think the ongoing issue which was sort of one of the terms of reference within the Mental Health Act review, 6 key areas for the review of 2018, that's when it reported, to pay attention to, and I was a member of the advisory panel, was 1, the rising levels of detention under the Mental Health Act, and 2, the overrepresentation of Black, Asian, and minoritized ethnic communities in inpatient settings. And so with the stat that I just shared with you, we can see that this is an ongoing issue that hasn't been fully attended to or addressed as yet. And it was within that context of the Mental Health Act review that I chaired a subgroup, which was the Mental Health Act Review African and Caribbean Working Group, which I co-chaired, which came up with a couple of recommendations, one which emanated from a previous report, which was around pressure on acute inpatient beds, led by Lord Crisp, was a recommendation around a patient and carer race equality standard framework, which I managed to get incorporated into the Mental Health Act review as one of our priority recommendations from the African and Caribbean Working Group. And the other recommendation, which Frank has also alluded to, was around culturally appropriate advocacy. So I might also say that for me, this whole agenda is actually really personal, because in all of those years of when the report came out in 2002, I'd already been a carer of siblings for well over a decade that were diagnosed with severe mental illness, that being my 2 brothers and my sister. And since then, in 2013, and 6 days after George Floyd, my 2 siblings passed away. And that has left me the ongoing trauma, actually, of trying to navigate getting the best possible care for one sibling in the context of services who perceive the the Black body as, I don't know what they, in so many ways, other than a humane way, meant that very rarely did my family get their needs met. And so when we talk about people with severe mental illness dying much earlier than other members of the population, I have that as a personal experience. My baby brother Barrett Carlton died at the age of 41, and my brother Barry died at the age of 54. This is absolutely staggering and shocking. And I've got a sister that I'm every day anxious about what is the outcome from mental health care in terms of her needs, because as it stands, the best support that she gets is actually from her family, even though mental health service provision is involved in her life. It's an ongoing journey of failure. So make no wonder, and we've mentioned Rocky Bene, then there's Olaseni Lewis, Sean Rigg. I mean, the numbers are ridiculous about when people are at their most vulnerable, they actually die in the care of mental health service provision when they are Black. So this report has an ongoing significance and relevance. What I am hopeful about is that through the Mental Health Act review and a couple of recommendations that are being progressed, that we've got an opportunity to transform this experience. And for me, hopefully, that my sister will benefit a transformed mental health services. It's unfortunately too late for my brothers. I'm actually shaking. Got the phone in my hand and my hand's shaking. And so the recommendation in terms of the patient and carer race equality framework is actually a significant achievement that seeks to build on and is learnt from the DRE and the Delivering Race Equality and other efforts on this regard, and serves as a race equity accountability framework, essentially a catalyst for change that works in where mental health service provision work in partnership with racialized communities to improve service provision at every level, in every service, and particularly in terms of access to appropriate and responsive services, better experience of services, and better outcomes. And so that sits within the Advancing Mental Health Equalities strategy, which Sarah mentioned earlier. The Advancing Mental Health Equalities Task Force is something that I chair via NHS England, and the Patient and Carer Equality Framework, the Patient and Carer Equality Framework, shortcut, the PCREF, sits underneath the task force strategy. And so the overarching strategy has three main work streams. One, which is around helping local health systems to improve. Two is around data and intelligence, and three is around the workforce. So the PCREF sits within helping local health systems to improve. So we're creating guidance to support all mental health trusts to develop their PCREF, to work with their communities in relation to their PCREF, so that they can really populate it with evidence that are making traction on improving access and experience for racialized communities, and that PCREF actually stands as a framework that is transparent to the public. So at the end of this financial year, the PCREF will become mandatory across all mental health trusts in England. And so it's a significant lever on this agenda to break the cycle of fear and transform outcomes for racialized communities. So in the framework, there are three parts in terms of the PCREF. One is leadership and governance around statutory and regulatory responsibilities. So within that, that's around the mental health, the implementation of the Mental Health Act. Many of you will be very aware of the overrepresentation of racialized communities in section 135, section 136, section 3. We don't really know what's going on in section 117 around discharge and aftercare. But we need to be much more transparent around these issues. The section that deals with compulsory treatment orders, where we've got 8 times the level or compared to white counterparts of Black bodies in being discharged under that restriction into the community. It's shocking. And so being really transparent around this kind of baseline data, and then looking how we're going to attend to changing those pipelines and pathways into care is the task of part 2. So part 1 also has the Use of Force Act, Patient Safety, Culturally Appropriate Advocacy, Care Act, the Equality Act objectives under the public sector, equality duty. And I was just in a meeting today, actually, while chairing the patient and carer, the PCREF steering group, where the work that we've been doing with the CQC has yielded such magnificent results, in my view, in a more robust single assessment framework and evidence gathering of the CQC in relation to mental health just around issues around equality and equity. And it's through the work of the task force and the PCREF steering group in helping to shape that assessment that we've got another lens on supporting much more purposefully improvement around this agenda. And part 2 of the framework is around organizational competencies. So in your trust area, is there co-production with racialized communities that are helping to change the trajectory of the data in part 1? Is there cultural awareness? Is there partnership working with voluntary sector and community organizations that essentially are led by partnering with racialized groups, so that they are more empowered to participate in helping to shape services to better respond to their needs? They are the experts. Service users, carers, and communities are the experts on what it is that they need. And Black-led organizations in this particular context of this report is absolutely paramount as partners in this agenda. So other organizational competencies are around data, around intelligence, around co-production, I said. I can't remember the honestly in my head. So apologies for that. And then the third part is around feedback from service users and carers in terms of a patient and carer feedback mechanism. And this is essentially a few clinical outcomes measures that we're going to pull together that best represent the experience, the outcomes from racialized communities as regards whether or not mental health interventions are making a diddly bit of difference to improving their health, their mental health and well-being. And then we're also creating a sort of digital feedback tool, which will be quite agile in being able to collate feedback from patients and carers to feedback to professionals, their teams, services, and the organization. So what you will see is a whole systematic kind of approach to driving forward improvements in it for Black communities, but equally for refugees and travelers, equally for Pakistani communities, equally for any other racialized communities. But in relation to this report and the Black experience of great significance, that we pay whole system attention to driving forward these improvements. And I mentioned before the Advancing Mental Health Equality strategy, and there's 3 strands, as I said. One which is helping local health systems to improve, the other which is data and intelligence, and we've done some work around a set of guidance for mental health trust provision to be able to categorize data in terms of the protected characteristics more consistently across the country when inputting data around episodes and mental health intervention into the mental health minimum data set around all activity across all services. But the third piece is around the workforce. And what we want is a workforce that is anti-racist, anti-discriminatory and anti-oppressive. That's the workforce that is required in this 21st century, and is the only thing that is, it's urgent in relation to our history of not being able to cater for people in this way. And so a competent workforce in this regard, as well as a diverse and representative workforce across all levels of the hierarchy of the decision making and frontline workforce. And so that work is cross-cuts into the work I do with Health Education England, where we lead, where we have a mental health equalities subgroup, which has 5 implementation work streams to really attend to the EDI agenda. So retention and recruitment of a diverse workforce, equality impact analysis, career pathways and opportunities, curriculum and policy development, and communication and marketing. So hopefully what I'm sort of sharing with you is some of the mechanisms, some of the architecture, some of the means of the system, mental health service provision, working much more effectively with service users, carers and communities on this agenda, so that we don't have this sort of disconnect and distance between what mental health service provision is providing and what actually are the needs of the population who need the mental health system to be at the top of its game when they are at their most vulnerable. Thank you.
Jacqui, thank you so much. You know, I've heard you speak and worked alongside you now for 5 years, which has been a great honour. And I think what I'm always struck by is, first of all, your generosity in sharing your reflections and sharing your experience. And I think there's probably no one on this call that doesn't send you love in relation to your siblings' experiences particularly. But watching you work, I've been really struck by how action orientated you are. That, you know, I think you've told me many times that we know, you know, we have the knowledge about all of this stuff. You know, actually what we need to see is tangible change. And through the Advancing Race Equalities framework, I have to say I've seen probably one of the most, I think I've said this to you before and in other places, but the most proactive strategy that I've ever seen happen within an NHS environment. And that's not a, you know, criticism of the NHS environment, but I've not seen anything that's been so bought into by the people around that table, by the innovation, by the connectivity between data and systems and environments. And I think when we come back to talk later, I'd be really keen to think with you about what actually about the leadership do we need to see that kind of carries that action orientated approach in other places, because I think your unique skills, you know, are unique, but what could we learn? Because I think that's the bit that I've been trying to co-opt in terms of my own approach to racial justice particularly, but just generally really difficult challenges. So I'd like to come back to that if we can. Thank you so much, Jacqui. We are going to hear from Chika next, and I think you are here too. Yeah, lovely. So Chika, I've got a question for you, and I know you've got some thoughts to share with us, but we would really like to hear your thoughts on the Changemakers programme. What made you decide to join as a co-producer? And we might need to tell people what a co-producer is in this project. What are your ambitions for this programme? And what would you like people to know in this call about your experiences and work, what you hope the world will look like in 20 years' time for Black people growing up in the UK? That feels like a massive question, but I'll leave it to you, and please let me know when you finish talking, and then we'll regroup. Thank you.
Hello, everybody. Lovely to be here. Thank you for inviting me to talk on this within this amazing panel. So yeah, Changemakers program. I decided to join about a year ago, and it's a program that was basically developed by myself and a few other co-producers with the support of UK Youth and the Dyer Award. So Changemakers is basically the whole aim of this program / project is to be able to look at ways in which we could help tackle or look at some of the inequalities for racialized communities when they're accessing mental health services. So yeah, the reason why I decided to join the program, I basically came across it on LinkedIn, and as soon as I saw it, I thought this is definitely a bit of me. It just definitely resonated with me, and the reason why is because I actually studied occupational therapy, and I worked within mental health settings. During my placement, I particularly had a lot of inpatient mental health placements, which is basically mental health hospitals. So this was kind of like my first insight into what was really going on in that world. And when I would go on these wards, I would just see so many people that looked like me being the main people within the hospitals, probably 90%. And I worked in maybe 2 inpatient settings, mental health hospitals, and I just couldn't understand why no one was really talking about this, but this seemed like it was such a huge issue. It was so shocking to see what was going on the wards. People were genuinely just not well. And it just made me think, I've never really heard about this. No one's ever mentioned this. And it made me realize that I think you only ever really see these things when you are either working within these settings, or, you know, a family member going through their own mental health issues, or you yourself are going through it. But no one really talks about also the racial aspects and the inequalities within the system and so on. So I just kind of wanted to find out more of the why and find out how I could kind of help to tackle the issues. So that's why I joined the Changemakers program. So yeah, I joined as a co-producer. So my role as a co-producer was to basically help produce the program. So it started off as just an idea, and we kind of got involved with the logo creation, got involved in how we would go about. So basically, with the Changemakers were the actual people that would be on the program, and they were just young people like myself that joined as Changemakers, and their whole role was to develop projects to help tackle this issue, or help look at this issue of inequalities within the system for racialized communities. So we basically tried to develop something that could push this program forward. So I've really enjoyed my experience, and I think it was amazing to see the outcome of it when we did a little social gathering. This was all during the time of the pandemic, when no one was really seeing each other. So I kind of finally got to see what was really what the kind of the work we had done. I got to see it in action when we had our little residential, and I saw the Changemakers, who are the people that basically created projects and so on to help with this vision. So there's some people that develop podcasts to help raise awareness on this issue. Those are one of the projects that were created. There was another project created called Not So Micro, where their whole goal is to try and inform people within the educational system about microaggressions and provide training within those systems. So there's projects along those lines, and other projects to do with basically providing a space/event where young Black people can come together and discuss these issues and talk about how they can make changes. So there's a lot that we got to see from this, and it was just incredible to see that these ideas were put together in a very short space of time, and I was part of that process. So yeah, I really enjoyed my time. I'm still currently someone's posted the link to Not So Micro in the chat. But yeah, so it was really amazing to be a part of it, and I'm still currently a co-producer for our next cohort of Changemakers, and it'll be exciting to see what projects they create as well. And the first cohort are still ongoing with their projects. So I think the question was what I would like to see in 20 years' time around this. I would like to, honestly, I would love to probably live in a fairy tale land and just not have inequalities exist and people not to be treated differently simply because of how they look or stereotypes or unconscious biases and so on. But I think it'll probably take more than 20 years to do that. But I would just like to see gradual change, people to be more aware that this is an actual issue, and for maybe less statistics around, for example, Black men being 17 times more likely to be detained under the Mental Health Act. I would like that number to reduce. So I would like to see better statistics around that. And I would like to see more people being aware of this and more people taking action. And yeah, more young people getting involved as well, because I think there's power in that. So I think those were the main questions. I don't know if I've missed anything else, but yeah, thank you very much, and that was all from myself.
Thank you so much. And what's really interesting is learning from you and thinking about, maybe the people, you only know if you know, right? So if you, like you said, if you work in this environment, or if you're, you're touched by it in some way. And it is true, because certainly I have conversations with people outside the system often, and when you're talking to them about some of these realities, it is deeply shocking. But why isn't this more newsworthy, and why can't we get it into the public domain? And I think that's why the stuff around Not So Micro and the campaigns that are coming out of the Changemakers program are still incredibly important, because it's still hidden in a way that for us who've been roaming around the system for a long time forget sometimes, actually, because it's our bread and butter in a way. But thank you so much, and thank you for all the work that you do. I know how incredibly important you are to the program, so thank you, Chika.
Thank you so much.
I keep muting myself by accident, but we are going to be joined by Kadra Ebenezer, who is our Associate Director for Children and Young People, and also the Strategic Lead for the Children and Young People's Coalition. And you will meet Kadra. Hi, Kadra. Lovely to see you. Kadra, just before we're going into a panel discussion, but as we've spotlighted you here just for a moment, would you mind just spending a couple of minutes telling us about the work that we have done in Birmingham, and a bit about the Changemakers program, just to remind everybody about that?
Yeah, of course. Thank you, Sarah. First of all, I guess I just wanted to say what a privilege it is to be speaking alongside this wonderful panel of speakers and activists. I'm really humbled and echo everything they had to say. And I also just wanted to really thank them for their relentless hard work and personal commitment to this space. It's really tough out there, but I think we've been making small steps because of the important work you all do. So I just wanted to share that thank you from me. In terms of the work we've been doing, I guess there's been sort of a growing focus around how racial inequalities impact on children and young people, and they do. Many of those sort of stark and shocking statistics we see in adulthood can all be traced back into childhood and the early sort of teenage years and adulthood. So just to touch briefly on the shift in the Dyer report, I think we can share a link to that in the chat somewhere. But this was basically an evaluation we did of a 3-year program based in the Midlands, focusing on young Black men's mental health. And it really sought to kind of reverse those trends around the overrepresentation of young Black men in acute mental health settings, and find ways to kind of embed preventative approaches within the community in settings and places that they're already at. So for example, we had a dedicated theatre group for young Black men led by them and for them. We had another organization called First Class Foundation that also put in place mentoring and peer support for young Black men. And then there was also a lot of work looking at upskilling young Black men's skills so that they have better chances of accessing employment, because we know that they are the group who are much more likely to face unemployment, and this negatively impacts their well-being and mental health. So yeah, I think that program really generated positive results. They worked with over 500 young Black men in Birmingham over the 3-year period. And I think, you know, the young men really valued a space to kind of be heard, to connect with like-minded individuals, and to kind of like explore mental health through sort of unusual kind of activities outside of sort of clinical settings. So yeah, please do have a read of the report and check out some of the recommendations they make there, which really build on the Breaking the Circles of Fear report. And as, yeah, I think Chika just really brilliantly summarized the Changemakers program, but I think what's really important and unique about this is about, you know, equipping young people with the tools and the resources they need to kind of develop social action initiatives around mental health and racial inequalities. So it's really about sort of rebalancing the power dynamics that we often see within mental health services, and particularly amongst young people as well. So watch this space. There'll be so much more ideas and projects to come. And yeah, we can keep you all posted on those.
Thank you so much, Kadra. And I think just to emphasize that point about the shift in the dial interventions are very much about working with people where they are, how they want to be engaged, completely directed with them. And I think that was something that was incredibly explicit from the report and the learning from that. The chat is going to be open for questions and reflections. We have Kadra and our other speakers are on the panel, so do you know, direct your question to whoever you think can answer it the best. But just before we do that, I mean, maybe Zach, you could spotlight the panel. I don't know if you can do that. I have no technical knowledge whatsoever. But I wonder whether there is a question that I can ask the entire panel really, and maybe come to Frank and Jacqui first, which is this question of leadership really, and recognizing the point that Kadra made, which was it's tough out there. And this journey is relentless. And when we think that this report was written 20 years ago, when we hear from Jacqui, who talks so deeply about, you know, these reports are fine, they reflect the truth of the experience, but the truth of the experience is lived. And so through that, the emotional labour is vast. And so I just wanted to ask a question about leadership. What is the kind of leadership we're talking about to drive change?
Anyway, I think it's, for me, I've seen an example of leadership. I'm working with the ones with Empowerment Community Network, and we or just in the middle of COVID, we launched an ethnic mental health improvement project, and the chief executive of the local mental health trust walked alongside us on that journey. And so it's not leading from the front, it's walking alongside people, it's listening to people's stories. And I think, Sarah, you've mentioned that I'm all for the listening. We just need to take a little bit more time to walk with people, to listen to what people are saying. Unfortunately, when we look at our leadership in the NHS, the leadership is still predominantly male and white. And I think so it's about allyship. It's how do we train people to become allies, because it doesn't happen overnight. And as I think Chika said, people don't want to have these conversations. And I think it's so you need to get allies to have this conversation. So it's not just about leadership, it's also that we need to really promote allyship. There are tools out there, and I would say, but I think that it's leaders who can walk alongside people. That for me is the key.
Thank you. I think that's a really interesting point. In fact, Jacqui and I have had this conversation about what allyship really looks like, and maybe we can come back to that as a very specific point that I know Jacqui has very clear thoughts on. But Kadra and Chika, do you have any thoughts you might want to share about the type of leadership that you want to see?
Yeah, I mean, I completely agree with what Frank has just said there, but I guess I think some work that maybe also needs to be done is like reframing what leadership is and what leadership looks like. I think in recent years, there's been a sort of growing focus on lived experience leadership, and that also needs to be a big part of this. I would also say, you know, young people as leaders as well, they might not be in positions of power, but I see people, young people like Chika as like incredible leaders, you know, paving the way for their sort of communities and for their peers. And that's something that, you know, we definitely need to kind of value and reframe, like whose voices sort of get prioritized, what is considered leadership. And that leadership comes in different forms at the local level and the national level as well, and trust level, etc.
Chika, do you have any thoughts?
Yeah, I completely agree with Kadra there. I think leadership, I would say, comes in different forms. And I think it's important to kind of understand what that kind of looks like. But in terms of leadership, I guess I would say it's important to have someone that really is passionate about what they're doing, about this specific area. And yeah, I think that would be my main add-ons as well.
Thank you. And Jacqui, one of the things I was just saying about the notion of leadership and allyship, you and I have had so many conversations on what does allyship really mean and what does it look like. And I don't know if you want to share any of your thoughts about that, because I think that it's, yeah, I mean, I think that it's really easy to claim allyship. It's less easy to do. And I know, Jacqui, you have some very clear.
Well, I think that allyship is really important. But let's define, as you say, allyship. And for me, particularly in this context, when we're talking about the experience of Black communities, it's around people who have power to elevate and support Black leadership in this context, across ages, which has been very well articulated here today, across gender, across disability, and the intersectionality therein from that racialized experience. And I think that applies at all levels of sort of mental health service sort of provision and systems. But I think there's also, for me, understanding leadership in a more broader sense, that not only is it leadership on the agenda in relation to where decisions are made, but also leadership of self, and what are the requirements in that regard. So I think that yeah, these are the kind of things that I think that need to be more brought to the fore. And I also think that we need to think in a less of a silos sort of way in terms of mental health service provision, because all components of people's lived experience that may lead them into mental health crisis need to be attended to in order to change that kind of trajectory. So for me as a political leader at my local level, it's how does this agenda get woven into what it is that we do sort of like locally in terms of the racial equity and social justice agenda, so that for example, when we're thinking about employment in my borough, 50% of our Black men are unemployed and have been unemployed perhaps since the Brixton riots and the Scarman report. If you read that report now, it's exactly the same set of circumstances in terms of poor housing, unemployment, lack of educational opportunities or other opportunities, etc., etc. And that's also a context where you've got in Lambeth, Black families, Black communities are 14 times more likely to be in temporary accommodation. So you've got all these interacting features of a racialized life that cumulatively and interact to create the risk factors that create mental health distress. So we can't just operate or be thinking about the symptoms. We have to show, in my view, leadership about addressing some of the causes. And this is now when we're really dealing with systemic racism and structural inequalities, and having those difficult conversations around tables where those conversations have not necessarily surfaced before, but are necessary in thinking much more creatively and in a sophisticated way about how we change that trajectory of experience. And in saying about the Black men's experience of 50% being unemployed in Lambeth, actually the Black women's experience is similarly going in that very negative direction. So that is also increasing to 40% unemployment amongst Black women, and increasing. I mean, this kind of data is absolutely staggering, but it is not unusual. And so wherever we're located as Black bodies, there is a similarity of experience that unless we surface these differential experiences, we'll be attending to a problem or a challenge that is mainly from a homogeneous kind of perspective, which is really around supporting the white experience. So the whole thing around allyship for me is also about really looking at white privilege and what it means to be white in terms of like whiteness and the benefits therein, and then being able to from that kind of position have a more informed conversation or negotiation or yeah.
Thank you, Jacqui. And I think that is something really powerful, which is how do we really encourage our allies to face the truth of their whiteness, and what does that really mean? And I've been incredibly grateful to you and others for that kind of ability to and space to talk that through, despite it being incredibly painful for people with racialized experience. That generosity and holding that space to really think it through is a privilege. We do have a few questions. One back to you, Jacqui, I'm afraid. One about we have Julie, who was an ambassador for the race equality program way back then. She said it was, you know, good program, and is there space within the PCREF to refresh it and roll it out into the ICS processes too, or do you think it's covered now within the Advancing Race Equalities framework?
I think that what the lessons that learned of what is best from the Delivering Race Equality agenda is absolutely integrated into both the PCREF and the Advancing Mental Health Equality strategy. The issue here now is around leadership and ensuring its delivery. So when I think, when we look at what the PCREF is about, and you just have to remember the name, it's the Patient and Carer Race Equality Framework. It's not the Workforce Race Equality Framework, although that is relevant as a component of the organisational competencies. But it is around working in partnership and co-producing with communities and Black-led voluntary organisations at the local level, and then that local level, how it manifests at an ICS kind of like level to drive this agenda. And so I think that it's really built on the strengths and the assets of what's gone before. It's not something totally new in a sense, but what it is kind of systemizing all that should have worked and could have worked if some backbone was put into driving it forward, and the sort of to sort of really support the empowerment of communities to be involved in sort of service improvements and service redesign in their best interest. And that's what this enables us to harness in quite a systematic kind of way. So we're talking about all services, we're talking about community mental health, transformation, we're talking about perinatal mental health, secure services, IAP services, inpatient services, acute services. I mean, you know, children and young people services. There is
maternity, yeah.
It's the whole shebang. We've just got to get down to business and be really focused and persistent in driving forward this agenda. And you mentioned as well around what does that mean for leadership in relation to allies or other parts of the system, not just around NHS statutory services. For me, it's about, okay, what does the PCREF look like in your organisation as a voluntary sector organisation? What does the PCREF look like as in the independent sector? And who, you know, all stakeholders that are aligned with this agenda, what does it look like? Where's the evidence that you are forwarding with the commitment and the urgency that this agenda requires? Yeah.
Thank you so much, Jacqui. I think that's really clear. We have a question here for you, Frank, which is about the open dialogue approach and what your thoughts are about how that might, you know, be well placed to surface some of the issues that we've spoken about today.
Yes, I'm as you know, I promote dialogue all the time, but I also would add to that it has to be authentic dialogue, because what I often find is that, and I like the idea of the peer dialogue, because then that's a dialogue where there's a parity of esteem in that. But if it's dialogue between a professional and a person with lived experience, then oftentimes the dialogue is driven by the script of the professional. And this is what mental health, so people with lived experience often say, is that their interaction is script driven by the professional, and that's not dialogue. That's not even anywhere near dialogue. And so it's about encouraging people to move away from the script and move closer towards the person who they are having the dialogue with, move closer to their agenda, and that their agenda should drive the dialogue and not, you know, not the scripted agenda. So yes, I think it's you know, and I think it's sad that it has never been written up. But years ago, we used to, I used to work with Mind, and Mind had a journal called Open Mind. And we had a little article in there, which I'm sure is somewhere in the archives, of a psychiatrist who had just decided that he was going to spend 10 minutes longer in his consultations with his patients. And after 6 months, his rehospitalization rates have dropped. His relapse rates have dropped. It's only 10 minutes extra, but it's a quality of that dialogue that's really important. And that's what I'm advocating, is saying, you know, move away from your script if you're a mental health practitioner and engage in authentic dialogue, or as the question here is about open dialogue. So I fully support that.
And of course, that's partly what the point you made earlier on about IAP services, which is, you know, for people from racialized communities, IAP hasn't always been the best source of help, because it's an incredibly scripted model, which means, you know, you can't deviate from the script in a way. And so what we've learned from Project Future and Shifting the Dial and some other work that we've been involved in is that it just doesn't create the space for anybody to be able to convey or disclose what's really going on for them. So I think that's a really important point. I think that we've got a bit of a question, and sorry we can't invite participants to ask questions directly themselves, but there is a question that I think we might have some thoughts to. It is a very tricky political environment out there, and I think that, you know, we won't talk about the last 24 hours because we might be here for another 5 days, but we know that it's been really difficult to get the government to hear some of the things that we've needed them to hear. We know that there has been some issues around the disparity unit not accepting the terms institutional racism, and all of these things that, you know, for us again is frustrating beyond words. But I wonder, what does that mean for us now? And Kadra, I'll come to you first, if that's okay. I thought you were just about to go for a sip then, so I thought I'll get you first. But what your thoughts might be, you know, especially in the work in terms of supporting young people to, you know, join the revolution, if you like.
Yeah, no, it is definitely a tough environment at the moment. And yeah, lots of the young people we work with just were completely outraged by the conclusions of the Commission on Race Equality report from last year. And yeah, I guess in some ways it really, you know, led to widespread collaboration in the condemnation of that report. And we kind of need to build on that cross-sector working and partnership. So although it's quite bleak, I will say it does leave me with a bit of hope in terms of thinking about collaboration around this work. And I think, you know, obviously national government can help drive things forward in some ways, but that's not the only way that we can realize change for Black communities. So, you know, the work and the show must go on at sort of local and community level to kind of try and test new ways of delivering support and, you know, addressing the sort of risk factors that face young people in particular, and just really getting on with that, building our evidence base around that, showing it works, looking at sort of like other drivers of change and influencing them, such as funders, local commissioners, ICSs. Yeah, whilst there's not that acceptance that we would hope for at a national level, there are still sort of like other mechanisms for change. And yeah, who knows, maybe if there is an election or any changes in leadership, we might just end up with somebody who does really see these issues. But yeah, I don't think it will hold us back really in reality, I hope.
Thank you, Kadra. Any other thoughts from colleagues on the panel about this issue of political environment and what it means for us in policy and campaigning?
So it's a tricky one, but as I say, I have always argued that you cannot separate mental health from the politics, because the decisions that are being made about resources for mental health are political decisions. They are not decisions that come of goodwill. And so therefore, there has to be a political edge to how we advocate for racial equality, but also for other forms of equality in mental health. And I think we oftentimes too scared because people think, oh, I've come into the service and I just want to care for people. But other people are making decisions about the tools you have and the resources you have. And those are political decisions. And we need to really understand that and find ways of working to that agenda.
Thank you. Jacqui, do you have any thoughts, Chika, before you move on? You're muted. Let's unmute Jacqui. Yeah, there she is.
I think I agree with both sort of responses, actually. I think that it's not one or the other, it's by any means necessary, and it's a range of thinking and activism, to be honest. And I think that wherever you're located, that contribution to advocate for the agenda is what is paramount. And so for me, when I think about how I sort of move, I'm not waiting for no national government to support this agenda. I'll still be advocating for that at that national kind of like level in every which way that I can in terms of the politicians. But I'm not dependent on that in terms of my leadership on this agenda, wherever I'm located, be that regionally or locally. I will not allow myself to be that disempowered. But my urgency, as I said, is also because of my lived experience, that means that I just can't allow a political kind of closed ear to kind of get in the way of me advocating for change and improvement. Lives literally depend on it. So yeah, I think it's all, and once again, for me, it's about perseverance and determination and persistence on the agenda. There's no time to slack on this. And you and I both know, Sarah, we've been on this for many years already. And for me, to some degree, some of the tide is changing in the there's, you know, some opportunities there. It's about actually really harnessing that and looking for opportunities where one may not have possibly looked for before. But for me, one of the reasons why I became a politician locally was because how can people be making decisions about, as Frank said, deployment of resources and so forth, and they don't look like me, they don't sound like me, they don't live like me? How can that be? So one has to place oneself in certain spaces where one
I think we just lost 10 seconds of that. Yeah, I think we only lost 10 seconds of it though, Jacqui, so that's all right.
Yeah.
We got that point. Yeah. My sense is, and I really do feel this deeply about leadership at every level, in every place that you are. And I guess my anxiety is that institutions don't take their eye off the ball, and that's where our role, I guess, really comes to the fore. And that, you know, where we kind of really bank together to kind of hold that line. And I think that's where having advancing race equalities and having the PQF and having these things in place give us a level of accountability we've not had before. I'm going to draw the panel to a close now as we head to the end of the event, but you know, we do want to invite the panelists to make one final comment, if you have one, about what we can do 20 years on from breaking the circles of fear. So much has happened in that time. It's no longer the kind of seminal piece. We've got so much more evidence now and research and activists and action going on that we have moved on, but there's still work to do. So I'm going to kind of go in reverse and come to you, Chika, first. After everything that you've heard today, what will you take away with you, and your final thoughts going into the work now with Changemakers? What do you think they're facing now?
So my final thoughts on how we can move forward, I would say, is to just keep talking, having these conversations and raising awareness about this very, very issue. As you said, we have come a long way. I think the report, even things like the report, are amazing, and they help so much in allowing people to see what's been going on, what changes can happen or have been made. But I think the more people are aware, the more people will want to action and do things. And just like someone like myself, when I became aware of this, I joined as a co-producer for Changemakers, and hopefully that makes a difference to someone else out there. So I think just having more awareness on this, more programs such as Changemakers, will make a massive difference. And these same people can go on into such settings where people are impacted, healthcare settings and so on, and they can make the difference. They can want to strive to go into leadership positions and make massive changes. So I think the more people know about this, the more people want to do. And yeah, that's my takeaway.
And certainly what I've observed watching Changemakers do their thing is very much about how, just because of the generational differences in many respects, what is natural to them in terms of campaigning and activism, which is actually quite different to, you know, a middle-aged woman, frankly. It's a beautiful thing to see that kind of pace, the innovation, the, you know, yes, we're going to do a podcast and then the podcast happens. You know, it is quite an extraordinary and brave way of operating. And so I just want to say a personal thank you. And, you know, I find the work that you and colleagues do on Changemakers extraordinary. And I look forward to the next, I think it's 7 years, Kadra, have we got something like that of Changemakers work? 4 years
Yeah.
on. Well, I'm adding another 3 on, right? So we're going to have of Changemakers work, and I hope that we'll be flooding the system with activists over the coming years. That's the intention anyway. Kadra, thank you, Chika. Kadra, what are your final thoughts to share?
Thanks, Sarah. You know, I've got lots of thoughts.
I love all your thoughts.
But I guess I want to leave people on 2 thoughts. I think a dream for me would be to have like a dedicated cabinet minister for anti-racism with a clear strategy that is well resourced. And as part of this, we need to really practice humility and center Black communities and invest in their work. Much of the solutions and like practices, as we know, are often there within the communities and they know what works. So we don't really need to always reinvent the wheel or pursue something new just because it doesn't fit in within sort of mainstream systems and language. I also think one thing we probably didn't get to touch on today, but I think we desperately need to right the wrongs of the past and ensure that people receive justice. I think I often talk about like a need for like a truth and reconciliation process within mental health services. I think there's been a lot of like harm done dating back decades. And now I think all of a sudden mental health organizations, both statutory and voluntary, are claiming to be anti-racist. It really does, I think for me, make the Black community feel gaslighted when that harm is not really acknowledged. And, you know, there's no apology really that comes with that or any kind of other compensation. So I really think, you know, addressing these issues for me is an important step in towards establishing trust and, you know, taking forward work that really helps to like reimagine mental health services for Black people in this country. So yeah, I'll end there.
Kadra, I always love your clarity about what the ask is, and that is the extraordinary progress that I think that we've made. I really think that the truth and reconciliation approach is a really interesting one, and one that I think I've really learned very much about since being at the centre, which is the generational impact of racial trauma and how completely corrosive that has been and continues to be. And at some point there has to be a reckoning of that in a way that is humble, that is meaningful. And I think it'd be really interesting to revisit this concept at some point as part of a series of exploration coming from breaking the circles of fear. It might be interesting to come back to that. And yes, a minister for anti-racism. Maybe not any of the ministers we've got right now, but you know. I hope this is not being broadcast live to the world, but never mind, it's the truth. Frank, what are your thoughts after what you've heard?
Yes, I'm after 20 years, I feel quite inspired. But I think I would echo Chika and Kadra's point around we just have to keep the dialogue going. We have to keep the conversation open. And I like the idea of a minister for anti-racism. That'd be really great. But yeah, and for me, it's we need to carry on chipping away. Yeah. So thank you very much for organizing this. I really feel privileged and humbled to be part of this. Thank you.
Thank you, Frank. And you are, you know, you are one of our, you know, idols in the organization. We really appreciate everything that you've done and continue to do. And we hope we'll be able to support you in future in that journey. And Jacqui, final words to you, and then I will close. But any of your reflections after what you've heard today?
No, it's great hearing the range of contributions and that we're still continuing this journey together, and I'm really excited by the intergenerational nature of the work. I think all hands on deck continue to be required, and that's just exciting and reassuring at the same time. It's interesting that it was said around reimagining mental health services for Black people. That's actually the tagline of the SLAM PCREF, actually. And so the first priority racialized group is actually Black people. And this is what we're doing, using the PCREF to reimagine mental health services for Black people. And I think that needs to be the agenda across the country, particularly in the context of this report. But I also want to just reinforce the point that we are building upon the shoulders of great people that have gone before us. And a big shout out to Melba, who sort of led the whole sort of like DRE, was Melba Wilson, I should say. And the resource that's been developed from a lot of the works and contributions that have happened from many assets are actually present historically, that are being currently collated via the Black Cultural Archives, and which is, Melba is like a historian. She's kept all the range of different resources from that whole historical kind of like work and activism around mental health that has been going way before breaking the circle of fear, and including that, and including the DRE. So what we are doing here in this moment, in this time, is cultivating and building upon that which has gone before us. And I believe, and I am hopeful, that we will yield the fruits of mental health services that are actually responsive and to what the needs are of racialized communities.
Jacqui, thank you so much. And I guess there's probably not much for me to add to all of that. Our experts have said it all really, but just to say thank you so much for sharing your reflections. Breaking the circles of fear has and was and continues to be an important piece of work here at the Centre, has set the tone since 2002 for all our work around racial justice, and we continue on that path. And it is great to see that Melba Wilson, who you've spoken about, Jacqui, has been here this afternoon listening to all of this. So we're part of her history that she's collating, which is a real honour and privilege. Thank you so much. We've put some resources into the chat, and we'll share some of those on, through email and so on. Thank you so much for coming this afternoon, everybody. We'll continue this work and these conversations, and we'll see you again sometime soon. But thank you, wherever you are, and take care. Thank you, Jacqui, Frank, Chika, Kadra. Thank you so much. Take care, everyone. Much love.
Thank you.